Hmm. All right. So last time we finished up all of mycology in one pretty nice long sitting. Wasn't the hardest thing. Mycology is not that big, so if there are some that you can't really recall that well, if there are any that you're struggling with, you got to make sure you go through it. Do the sketchy micro. The video has the sketchy micro images too. It's on the playlist right now. And just make sure you know these fungal infections very, very well. You should be able to differentiate them from each other. There's really just two groups. There's the group of systemic mycoses with histo and blasto and all those guys. And then the group of opportunistic fungal infections from Candida all the way to PCP, right? Pneumocystis pneumonia. Those are all very different from each other. There are very few overlapping features, right? And the overlapping features are not what you need to remember. You don't need to remember what they all share, but instead you really need to remember what's different about them so you can actually pick one answer choice over the other. Right, so now we're looking at microbiology, parasitology, right? So we're going to be looking at all the protozoal infections, and these guys, there's a lot of imagery associated with them, right? Because you're going to need to know how they look, right? How do these parasites actually look under the microscope? You really need to know that because it can easily be given. Their life cycle is often provided as well, right? Sometimes they'll have a vector you need to know, right? So a lot more than the symptoms is actually what's more important than the symptoms is actually how they look and how they present, where they present, stuff like that. So let's dive into that. Let's see how it goes, and I'm gonna try to get through as many of them as I can right now, before we start doing virology, which is a whole different chapter, and also not that bad. Now for parasitology, just like everything else in microbiology, I do have the sketchy micro images there, as well as extra pictures to help you really know everything you need to know about the bug, right? So let's dive right into it. First thing we see are gastrointestinal infections, right? So you have your Giardia lamblia, Entamoeba histolytica, and Cryptosporidium, right? So these are the three that they talk about for gastrointestinal, and then they'll go into CNS. Now, this Cryptosporidium, a lot of students I have seen have had issues with Cryptosporidium versus Cryptococcus neoformans, right? Completely different guys, right? Cryptococcus is a heavily encapsulated yeast that you can see with one of many different stains, right? India ink, mucicarmine. We even saw you can use silver methenamine, and then of course the latest agglutination. And this Cryptococcus caused encephalitis, right? Soap bubble lesions in the brain. That was the main thing. It had mostly CNS issues, whereas Cryptosporidium is more about the GI, right? Gastrointestinal infections. So let's look at these three guys. The first up, Giardia lamblia. Causes giardiasis, which is just bloating, flatulence, foul-smelling, fatty diarrhea, often seen in campers or hikers. Think fat-rich Ghirardelli chocolates for fatty stools of Giardia. Now, if you've never had Ghirardelli chocolates, you're missing out on life, right? Let me show you real quick. So Ghirardelli is actually a really big chocolate company. It's not just in America either. It's pretty international, right? So South America and whatnot, and super delicious stuff. Like, these are so good. I think more than showing you guys, I just wanted to look at it myself. Like, oh yeah, milk and caramel all day. But yeah, it definitely works. Like when I was studying, I had no issue remembering giardiasis at all. There's really no way to mistaken giardiasis for anything else. Now, the reason it involves campers and hikers is because when they go camping or hiking, they often tend to run out of the water supply they brought with them, and then end up drinking water from wherever they are, and there are cysts in the water that they end up drinking, right? So diagnosis is going to be through multinucleated trophozoites or cysts in the stool, right? And then you can also do antigen detection. So A and B, right? So you have this trophozoid that has these two eyes, right? And it's pretty easy to capture this. But if it's a bad image, you can also try to be confused, right? The test is going to try to confuse you by also showing you things that really resemble, like, we're going to see actually much later on, things that you can see in like Epstein-Barr virus with the owl eye cell. So you got to make sure that you can see more than just the two nuclei, but also the extensions it has and this line in the middle that it has. Very important to be able to like differentiate between Giardia as well as other bugs that can look a little bit like it, right? So more than its shape and the two eyes, more important than that is the fact that it has all these extensions coming out. Giardia in daycares. I don't think I've seen anything about it in being in daycares, because daycares usually do have clean water, right? So daycares are usually going to have clean water to give to the children, whereas going camping or hiking, you're always exposed to water that isn't necessarily filtered, for example, right? Alright, so let's take a look at and then the last thing, of course, for all of them, generally speaking, for all of them, the treatment tends to be metronidazole. Giardia is the easiest. It is just metronidazole. For others, we're going to see some extra medications that are pretty specific. Alright, so we're going to see that soon enough. But let's look at Giardia. So this is the Giardia sketchy micro image right here. Right, you can obviously tell these kids are out camping or hiking or one of the two. Alright, so let's take a look. So Giardia lamblia, Giardia jungle ride, associated with hikers and campers. So we have our campers in the story, right? So these kids are here. The typical story is people drinking unfiltered water from a stream in an area endemic for Giardia. The fecal oral transmission is represented by the floating poop and the poop-tinged water. So you can see this one floating poop right here, and then the water is all brownish colored. So that's supposed to remind you of the transmission. And then, of course, cysts and water are the given thing. So you're going to see cysts. And cysts are always depicted by bubbles. We're going to see that too. The bubbles are the reoccurring symbol to depict that transmission is by cysts. Right? So those, you're going to see bubbles in many other images. And every time you do, you have to remember there are cysts involved. It causes bloating, flatulence, and foul-smelling diarrhea. Hence, the campers who are holding their nose, right? Because someone's obviously farting a lot. So that's just what's happening. This one's holding their nose, this one holding their nose. So stuff like that. The stool is yellow to depict the fatty, non-bloody diarrhea, which is a very important distinguishing factor, right? So there's no blood involved. It's literally just causing fatty diarrhea. So they are going to lose fat-soluble vitamins as well. Consider health problems from the lack of fat-soluble vitamins, because none of those will be absorbed either, particularly vitamin E. So you want to see kids who are presenting with symptoms of fat-soluble vitamin deficiency. The distinct look is shown in the scanning electron microscopy image. Note the flagella and ventral sucking disc. So that's the image that I put right here. Alright, so you can see all the flagellas, and then it has a tiny sucking disc right there that it uses to kind of attach onto the GI lining. The indigenous looking shields on the boat are for the shape of the shape with the flagella and the sucking disc. So all these little shields that they have here are to remind you of what it actually looks like. And you can see one floating over here in the water as well. So they have flagella and they have a sucking disc. The trophozoites attach but do not invade the intestinal wall, which is why it's not bloody diarrhea. Entamoeba and many others that do cause bloody diarrhea are going to be able to invade the intestinal wall. Some shields are in the water because finding them in the stool is diagnostic in a stool O&P. ELISA stool antigen test also works, hence the name of the boat is ELISA, right? So that's what they put here. Antigen detection is always a great way to find it. It's just not the most accurate way to do it. It's much easier to just look at their stool, and that's it. Treatment lies in Disneyland, which is, this image is actually supposed to depict a certain part of Disneyland where you do have a train going like that, and people are able to like walk around and there's water and stuff. So treatment lies in Disneyland. Behind the Jungle Cruise is a monorail, and here we have the metro for metronidazole, right? So that's the monorail right there. Anytime you see a train, it's always metronidazole. We've seen it in a couple of pictures so far, not too many. So this is one of the few where you just give metronidazole. No other treatment is here, right? So there's no other treatment-related imagery in that picture. It's literally just metronidazole, and you're good to go. Now, Entamoeba histolytica causes amoebiasis. Amoebiasis is bloody diarrhea, right? So dysenteric diarrhea. Liver abscesses also, so you have this anchovy paste exudate from the liver, and right upper quadrant pain, which will often resemble like a gallbladder issue. Histology of the colon biopsy shows flask-shaped ulcers, and that's what I have right here. Right, so this is a colon biopsy. Let me make it bigger. So this is a biopsy from the colon, and you can tell it's from the colon because you have these really, really big glands, right? And this is a flask-shaped ulcer, right? So you can see how it has the opening up here, and then it's just extending more towards the right. It's not even, I understand that, but that's what they're referring to when they call it a flask-shaped ulcer. Now, in your test, they can give the same image upside down as well, so don't let that confuse you, right? It'll still be a flask-shaped ulcer. It could just be upside down with the top of the flask actually pointing downwards. So that's still the same thing. So now compared to Giardia, Entamoeba is different because Giardia only causes fatty diarrhea and flatulence, whereas here Entamoeba histolytica causes bloody diarrhea and it causes liver abscess. Right? This is also coming from cysts in water, and to diagnose it, you can go ahead and do the ELISA antigen testing again, or you could find trophozoites, right? And these trophozoites are engulfed. They're gonna have engulfed red blood cells in the cytoplasm. We're gonna see that in image C. Or you can also find cysts with up to 4 nuclei in the stool, multinucleated cysts. And we had multinucleated cysts for A also, so very careful to not make that mistake. Right, A and B are your trophozoites and cysts for Giardia. Right, so this is the cyst, and this is the actual trophozoite itself. Whereas here, the bug itself has literally just eaten a bunch of red blood cells. So that's what you're seeing. These are not nuclei, right? And then the cyst looks a lot more like the bug itself, right? Same kind of 2 eyes or whatever, but it doesn't have any flagella, doesn't have any midline distinction. Right? So very important to know the imagery, because you can get any one of these images. You can even get a question where you would know what the bug is, and then the answer choice is actually all images or description of images, just like they're describing it right here. Right? So you're going to see trophozoites with a bunch of red blood cells that they ate, or cysts with many nuclei. And this is a cyst with 2 nuclei. Treatment for Entamoeba histolytica, again, you could use metronidazole, but this also has paromomycin or iodoquinol for asymptomatic cyst passers. Right, asymptomatic. So if you have a question where a patient is asymptomatic, but they do have cysts in their stool or trophozoites in their stool, they just don't have symptoms yet, they don't have any bloody diarrhea or liver abscess or pain in the right upper quadrant, then you just give them paromomycin or iodoquinol. Right, so now we're going to look at this image right here, which is for Entamoeba. Now let me see if I can find a more HD picture, because this is pretty blurry. I should be able to. Sketchy micro Entamoeba. Yeah. Definitely much more clear. Just make sure it has everything. Yeah, it has everything. Okay. So let's just take this clearer picture instead of this one. Okay, well, let me make it big for now, since we're going to talk about it. So all the sketchy micro images are on Google. They are accessible for free. They just don't have the story with them, and I definitely encourage still watching the videos, even though I do share the story here, because when you watch the video, it's a whole different effect compared to how I'm talking about it. You actually get to see these things start from pretty much a blank canvas, and it just sticks to you a lot better that way. Here I'm just sharing what I used to memorize it, right? So this is the image for Entamoeba histolytica. You can already see a lot of things that you probably recognize what they're going to be symbolic of. This is called entering the historical dig. So it's Entamoeba histolytica, right? The title actually kind of matches the name. So Entamoeba histolytica, entering the historical dig. Causes bloody diarrhea. The do not enter sign on the bottom right has ENT and HIST highlighted, right, to remind you of Entamoeba histolytica. There are two life stages. First, you have the bubbles in the puddle, which is a recurring symbol for cysts, and that is the infectious form. So you see some people drinking it, right? So there's a bunch of bubbles in this, and these people, for some reason, are deciding to drink that not so clean water. This is also highly associated with men who have sex with men due to anal or oral transmission. Hence, the men are holding hands. So these two guys, right? They're both drinking and they're both holding hands. While it resides in the GIT, it invades the colon and enters circulation. Hence, the dig on the left side, right? So this is what they're doing right here. They're kind of invading into the floor. That's what's supposed to be reminding you that this does cause invasion into the colon. You can also see the guy on the bottom left holding what looks like a CT of the left liver. CT of the liver, and there's a solitary lesion on this side right here, not the left. Okay, because the guy's on the left, but that's actually the right lobe of the liver, right? And there's some kind of cavitation in there. That's what this is. But in this picture itself, what it's supposed to represent is this entire big excavation site, right? The whole big excavation site actually looks like the liver, and they're cavitating into the top right portion of the liver as well. So that's what this quote-unquote map, aka the CT, kind of looks like. Patients may complain of right upper quadrant pain. The pus is classically described as having the consistency and smell of anchovy paste. Hence the truck up here, right? This truck is just delivering a bunch of anchovy paste. Aside from liver abscesses, this also causes intestinal amoebiasis, which has ulcerations in the colon. So the colon-looking pipe with red spots is there to depict that, right? So this entire pipe has many ulcerations in it. That's your colon ulcerations right there. In the microscope, you would see Erlenmeyer flask-shaped ulcers. So you have this one flask floating in there. And obviously this means it's invasive, so the stools people are sitting on are red for bloody diarrhea, right? Red stool. Diagnosis is with the stool O&P. So you see it says that on the pipe, right here. Very hard to see it, but it says O&P on the pipe. And that's pretty much true for all three of these guys, the gastrointestinal ones. Look for trophozoites with endocytosed red blood cells depicted by the puddle under the pipe, which looks like an amoeba with red dots, right? So this actually looks like a little amoeba here, and many red cups are in there for red blood cells. A colonoscopy would show flask-shaped lesions as well. Treatment is with metronidazole, hence the metro again, right here, but they've derailed it. Some drugs work by removing cysts in the lumen of the intestine, where drugs have difficulty penetrating. The first luminal agent is paramomycin, depicted by the pair of mice running out of the lumen of the tunnel, right? These two guys. And often excavation sites always have mice, so it kind of falls into the picture very well. The other luminal agent is iodoquinol, hence the sign called Queen Iodo's tomb. Right, now that's really hard to read in this picture right now, but this is basically the story of this picture is that they're excavating to find this queen's tomb, Queen Iodo's tomb. And you're always going to remember Queen Iodo because when we get to malaria, that's where we're going to see who Queen Iodo is, and iodoquinol is going to be one of the medications there, so it'll become much more important there. But anytime you think of this image for amoebiasis, first things first, always think of the amoeba right here, and just remember that it has red blood cells in it, right? And then remember the colon and the bloody diarrhea, the Erlenmeyer flask, metronidazole, and paramomycin. Iodoquinol I haven't really seen get tested much, but I have seen paramomycin as one of the medications, mostly because it is just very specific to this bug, so there's really no other instance to kind of test you on it. And then the right upper quadrant pain presentation is pretty common. So these patients don't always present with bloody diarrhea. They might get bloody diarrhea later on, or there might be occult blood in their poop on fecal occult blood testing, but they might actually just present because they have right upper quadrant pain. And then you might do a CT and you might see this. They're going to try to confuse you with these cavitations a lot because this isn't the only bug that causes a cavitation in the liver. Right, so you have to make sure you look for what else is being given in a question stem to really grab that correctly. Alright, so we got these three guys. Alright, so now the one in the middle, this one, Cryptosporidium. This is very important for AIDS patients. Anytime you get an AIDS question, this bug is only high yield because it's related to AIDS. Okay. Severe diarrhea in AIDS, mild disease or watery diarrhea in immunocompetent hosts, oocysts in water, right? Oocysts in acid-fast stain, antigen detection, prevention by filtering city water supplies, and then you have another medication right here, nitazoxanide in immunocompetent hosts, right? So you can't really do much for AIDS patients. So again, this is also very different from the other two above. The most distinguishing factor for it is that acid-fast, right? Oocysts in acid-fast staining. I'm showing you that here. They're also showing you that in image E, right? So anytime you get a patient coming with diarrhea, and it's not bloody diarrhea, the only one with bloody was Entamoeba histolytica, right? Coming with watery diarrhea, bloody diarrhea, fatty diarrhea, completely different types of diarrheas. Now coming with watery diarrhea, and then you do an oocyst staining and a stain with acid-fast on your question, it should immediately ring a bell for Cryptosporidium. And then nitazoxanide is a difficult medication to remember. So is paramomycin, because these medications never really show up for any other bug or any other issue. So you have to do your best to remember it. Now paramomycin were the pair of mice for Entamoeba histolytica. Let's take a look at what's happening with Cryptosporidium to understand what's up with this bug. All right. So this one's called Tales from the Crypt, which definitely worked for me because this is underground. He's in a crypt. This guy is definitely doing something that's, he's either homeless and he's searching for something, or he's part of the cleaning crew. And he actually looks like he's homeless and he's searching for something. He doesn't look like he's dressed up for something professional. So we have in AIDS patients, the background is a flooded crypt. In AIDS patients, this causes severe, unrelenting diarrhea and is most commonly identified in HIV patients with diarrhea. Hence, we have the immunocompromised cane patient in the crypt and the dirty water for watery diarrhea. Right, so we have all this water is just supposed to remind you of watery diarrhea, but they're also showing this pipe over here, which obviously is your intestines, and it's dirty but watery diarrhea, right? And he's holding a cane, so immunocompromised, usually HIV patient. These are unicellular, partially acid-fast organisms and complete their entire life cycle in a single animal and release oocysts that can be transmitted orally. The poncho is for acid-fast, and the bubbles are for infectious cysts. Right, so all your oocysts are going to be depicted by bubbles all the time. His poncho, though, the one he's wearing right here, right, should definitely remind you of the acid-fast part, but also, more importantly, these little gems all over, that's going to remind you, right? The scattered amethyst gems are for what they look like in acid-fast staining. The gems are also multifaceted to represent that each oocyst is composed of 4 motile sporozytes which attach to the intestinal wall and cause small intestine damage. Hence the narrow pipe rather than a fat one for the colon. Right, so that's another very important distinguishing factor that definitely sticks. Up here we saw a really thick pipe for the colon, right? Here we're looking at a really thin pipe underground, and that's because this affects the small intestine, not your large intestine. All right, so the small intestine is involved here. However, it can cause colitis as well, but that's not the bigger part. Your question will tell you that the small intestine is involved, and they're going to tell you something regarding that. They might even say that they got the biopsy from the small intestine for whatever reason, and then you're going to see acid-fast stuff in it. If your patient has diarrhea and you see oocysts with acid-fast staining on stool OMP, you can treat it with nitazoxanide, which you can only use in immunocompetent hosts, hence the knitted sock, right? So this sock is supposed to remind you of nitazoxanide, knitted sock, nitazoxanide, etc. This is a play on words, but more importantly, there really isn't anything else this sock can remind you of, right? So it must be the treatment because there's no other thing in this image for treatment, right? There's no treatment visualization in this image. Now, personally, for me, the sock didn't really work. I would remember the sock and that he's holding it, and it would remind me the other thing, which is filtration, right? Filtration can remove cysts from infected water, and you can see water being filtered from the sock. That I can definitely remember, but I would never remember that it's a knitted sock for nitazoxanide. But eventually, after talking about it more and more times, and then, every time I lecture about it, it's like another revision. It did start, coming to mind and sticking to me a lot better at that point. The other medication that isn't mentioned in the book is called spiramycin. And I did Google it. It is a real medication. It is used in America. Spiramycin is a macrolide and can be used as well. Hence the spirit crows, right? So all the macrolides are usually crows, right? Here we have spirits of crows, so that's why they're white. But this is not FDA approved, so that's why it's not in the step 1 book, and it's probably not going to be on your test either, so don't really worry about it too much. Hydration and electrolyte balance is critical. So you're going to get an HIV patient with tons and tons of watery diarrhea, and as soon as you hear that, you should remember Cryptosporidium. Remember that it's related to the small intestine and that it's going to stay in acid fast, and you just got to replace the water and electrolytes that they're losing because you have no treatment for immunocompromised patients. You can't give them anything. Alright, so no treatment when it comes to an immunocompromised patient. Let me see how this was. I think it was like... And there you go. Okay. Alright, so that knocks out your 3 GI manifestation protozoa. Very straightforward, very different from each other. Almost no overlap between them at all, besides the fact that they all have cysts in water, but that's what protozoa are. And then I have a couple pretty simple questions here from UWorld, so let's take a look at that. As soon as you see this image, you can already identify it, right? You can already see what this is right away. So let's look at this one first. 19-year-old man comes to the physician due to watery diarrhea for the last 4 months. He visited a student health clinic at his university a month ago and was prescribed a course of antibiotics, but his diarrhea failed to improve. He also has persistent nausea, a bloating sensation, and a 15-pound weight loss. Microscopic exam of his stool for ova and parasites, which is O and P, following trichrome staining, is shown in an accompanying image similar to the top left image above. So basically this image right here. Impairment of which defense mechanism would most likely predispose to this patient's condition? Right, and the answer was really straightforward, but a lot of people messed it up. And this is pretty much an immunology question being mixed into microbiology. Impairment of secretory IgA production would make this 19-year-old man much more susceptible to this So as soon as you see this picture, you already identified that it looks just like this image right here, which is obviously Giardia, right? So this guy has Giardia, and his diarrhea they described is not bloody at all, right? So that's good to go. So it's pretty easy to identify as Giardia. This question was immunology related. They wanted you to be able to know that if anyone is missing secretory IgA, if you're not making IgA, then your gut lumen is not that well protected, right? And your respiratory lumen, everything, that entire luminal pathway is not well protected. But 41% of people chose eosinophil-mediated cytotoxicity. That if someone's eosinophil-mediated cytotoxicity is not working, then they would have this issue. Now, IgA and Giardia are discussed in immunology. We talked about that already. And page 139 explains the increased susceptibility to giardiasis and selective IgA deficiency. All the things we talked about in immunology. Right? Selective IgA deficiency patients do have more or recurrent Giardia infections. In the image, you can see the pear-shaped organism with its multiple flagella and 2 nuclei that resemble owl's eyes. Small bowel biopsy is performed when stool studies are non-diagnostic and can show varying degrees of villus atrophy and crypt hyperplasia, depending on the severity. The major immune mechanism against Giardia involves CD4-positive helper T cells and secretory IgA production. Children with IgA deficiency or any other disease that causes IgA deficiency have a predisposition to developing chronic giardiasis. Eosinophils are more important for combating intestinal helminthic infections, right? So that's the big difference there that a lot of them failed to grasp in that UWorld question. This next one says, a 3-month-old infant is irritable, feeds poorly, and frequently vomits. His current weight is at the 45th percentile, and his head circumference is at the 96th percentile. So feeds poorly, frequently vomits, only 3 months old. Okay. Fundoscopy reveals white-yellow chorioretinal lesions in both eyes. Head CT shows enlarged ventricles and scattered intracranial calcifications. What is the most likely cause of his condition? And the answer was it was an in utero infection. The description of this infant, we haven't covered it yet, but this is toxoplasmosis. Let me see. They say hydrocephalus, intracranial calcifications, and chorioretinitis form the classic triad of congenital toxoplasmosis. Hydrocephalus occurs due to CNS inflammation and is evidenced by macrocephaly and enlargement of the ventricles. And they mentioned enlarged ventricles. Okay. Chorioretinitis refers to inflammation of the choroids and the retina that can leave cotton-like white-yellow scars on the retina. Affected neonates also have hepatosplenomegaly, rash, and multiple neurological abnormalities such as seizures. Pregnant women should be warned not to handle cat litter. And that's something that you're going to see. The picture for Toxo does a great job helping you memorize all of it too, so when we get there you'll see. This next one is also Toxo. It's a 42-year-old man brought to the emergency department following an episode of generalized tonic-clonic seizure witnessed by his family. He has no prior history of seizures, but has had headaches for the past several weeks. He works in construction, and he has no history of travel outside the U.S. Nor has he ever had any pets. He smokes a pack of cigarettes daily and drinks 3 to 4 cans of beer every evening. Physical exam is notable for post-ictal state. Fix that real quick. Oral thrush, and several enlarged cervical and inguinal lymph nodes. An MRI of his brain with contrast is shown in an image that depicts multiple ring-enhancing lesions on MRI. And ring-enhancing lesions are pretty much always going to be toxo, but especially if the patient has HIV, which it really looks like this guy does, right? Because of his oral thrush and lymphadenopathy and all that. So the answer was toxoplasmosis. The most likely cause of his symptoms is toxo. He has HIV given his oral thrush, cervical and inguinal lymphadenopathy, and brain lesions. Seizures are a common complication of multiple ring-enhancing lesions, and extensive pet exposure is not essential for the diagnosis, because toxo can also be transmitted through contaminated foods, which is more common in males. And there was also another, I don't know if I have that question here in the book, but you will also had another really weird question about a woman who was pregnant and ended up having toxo, and answer choices included both cat feces as well as undercooked meat of some sort, and the answer was the meat, not the cat feces. I do think that question is in the book somewhere, so when we get there we'll see it. But it's very important to remember that although cat litter can give you toxo, there's a very small chance that a mother would actually be playing with cat feces or even messing around with the cat litter, and if she is, that she would actually have contact with the feces directly. But for that thing to get into the food, or for the cat to shed something into the food, is much more likely. And I think that's what that question was, that question when you wrote was teaching at that point. So hopefully I do have that question somewhere. Otherwise, if you guys ever see that question, then you'll know now that that's the correct answer. So Toxoplasma gondii was the next thing, which is why we had 2 questions right there. These 3 guys that we're about to look at right now: Toxoplasma, Naegleria fowleri, and Trypanosoma brucei. These 3 are CNS infections, right? We just looked at 3 that cause GI infections. Now we're looking at CNS infections. First up, we have toxo. Immunocompetent people will have mono-like symptoms with the negative heterophile antibody test, right? The positive heterophile antibody test would be actual infectious mononucleosis from Epstein-Barr virus. Reactivation in AIDS can lead to brain abscesses, usually seen as multiple ring-enhancing lesions on an MRI. And this is shown right here. So it doesn't always look exactly like this, but basically you're going to see something similar to it. Congenital toxoplasmosis is a classic triad of chorioretinitis, hydrocephalus, and intracranial calcifications, just like we saw in that question we did above with the 3-month-old infant. So what's happening here? And then they tell you here, see the transmission. Cysts in meat are the most common, right? And then oocysts in cat feces are the second thing. And what happens is the cyst is able to cross the placenta, which is able to then go ahead and cause congenital toxoplasmosis. So if you get a question and both answer choices are there, you pick the cyst in meat, right? And how did the cyst get in the meat? Maybe the cat was around the meat at some point and it just, touched it or even took a bite into it. Who knows what the cat was doing or how it got there, but that is the most common, rather than the cysts in cat feces. Pregnant women should therefore definitely be avoiding cats at all costs. So diagnosis is by serology or a biopsy. Now if you do a biopsy, you're going to see something called a tachyzoid. Right? A tachyzoid looks like this. It basically looks like a purple banana. Right? I've always thought of it like that. A purple banana is what it really looks like. It's pretty unique. It can kind of match other guys too, and as you could tell, it's very easy for another image of C or D to look a lot like B as well, like a different variation. So be careful with what the question is about. Obviously, no one's just going to give you the picture and ask you to identify it. So the question stamp should definitely help. Now, treatment is sulfadiazine and pyrimethamine. All right, so it's a sulfa drug, and that's always been eggs in every image. So let's see what the eggs are in this picture. This is your sketchy micro picture for Toxoplasma, where of course the pregnant woman in the yellow shirt is playing with a bunch of cats, not just one. Alright, so Toxoplasma gondii. This is called Ohai is making some toxo. It's based off of a very Japanese kind of way of talking, but the title won't really help much as just the visual aspect of seeing this. So this picture has one woman, she's wearing a yellow shirt, she's pregnant, she's picking up cat litter, and there's a bunch of different cats that are going to depict different things. It can infect any warm animal. It is carried by 30% of the population and it has no symptoms in the immunocompetent. Cats are critical and it affects pregnant ladies and immunocompromised people. You see the cat lady in a yellow shirt is pregnant and she can transmit it transplacentally. And it is one of the torches infections, right? The torches infections, the T is toxo. Hence the Statue of Liberty cat with this torch. And you're going to see a torch in every torches infection that we do. It can also be transmitted by raw or undercooked meat with toxocysts, or via ingestion of water or vegetables with cysts from infected animal feces. So there's 3 different modes of transmission that Sketchy talks about. The pregnant woman is cleaning cat feces, which is not advised. A bird egg fell into the feces because it's an oocyst and in the feces that will transmit the disease. Right, so what you're supposed to be able to see is this one right here. This random egg that's in the cat litter, right? And she's picking up one poop right there on her scoop. We have our immunocompromised cat with a cane and glasses, and he basically, because of the glasses, very much looks like Mahatma Gandhi. So that's really going to help you remember that this is T. gondii, which, if you're new to Toxoplasma gondii, then you just call it Toxoplasma gondii, and you remember Gandhi over here too. The extra lenses on the glasses are for brain abscesses, seen as ring-enhancing lesions on CT or MRI. His red turban is for encephalitis, as usual. Brain biopsy will help differentiate from CNS lymphoma, hence the needle in his turban, which is just holding his turban in place. Right, so if you want to differentiate between, is it a Toxoplasma-induced encephalitis or is it a CNS lymphoma, you have to do a brain biopsy. And when you do that biopsy, for toxo, you would see the ring-enhancing lesions, you would see the actual bug itself, which looks like the banana that we were looking at earlier. So that's pretty much what you're going to be able to catch there. The bubble-looking meat the cat is pushing is to depict cysts, right? This is right here. Right? He's pushing it over. This stuff in here kind of just will help you remember all the cysts. Clinically, healthy people will simply have flu-like symptoms, if any. They could just have no symptoms too. For HIV patients and the fetus, it can be fatal. In congenital infection, you note chorioretinitis, hydrocephalus, deafness, and intracranial calcifications. The kitten with milk on its head is for the intracranial calcifications. Right, this one right here. Right, and it's drinking milk, but the milk got on its head. So that's the intracranial calcification right there. The kitten with milk on its head. The cat with the bowl stuck on its head is for hydrocephalus, and he's shaking it off because of that's to remind you of seizures. Right, so we got 2 of these guys already. We talked about the Gandhi dressed cat. This is seizures and hydrocephalus. This is intracranial calcifications. The flash of the camera represents chorioretinitis. She's taking a picture of it because it all just looks really cute to her. There's one more symptom depicted by Beethoven because he was deaf and congenital toxo can cause deafness. Right, so this cat that's dressed up as Beethoven, as great of a musician as he was, and as great as his music was, he couldn't really hear it himself. Right, so if you didn't know Beethoven was deaf, now you know. Diagnosis is made by serology or biopsy, where you look for cysts. However, active infection is not certain. Treatment is with sulfadiazine, hence the sulfa eggs, which you can see right here. The eggs have pyramid shapes for pyrimethamine. It's really hard to see it, but there's a little tiny pyramids drawn all over it. But if you just remember the sulfa part, you have to give both drugs as a medication. So hopefully you remember the sulfa and the pyrimethamine both. The last thing is for HIV patients with a CD4 count under 100, you need to give prophylactic trimethoprim sulfamethoxazole. So that's why you have this other cat dressed up as Benjamin Franklin with this $100 bill to remind you the 100 CD4 count. Their IgG may be positive for toxo, represented by the kite with an Ig key. And this is also supposed to remind you of the really messed up thing Benjamin Franklin used to do, where he would give little boys a kite and a key, and they would just run with it. And if they got electrocuted, it would actually kind of teach that electricity can be used like that. He helped understand and develop how the light bulb would work. So as much as he might get good credit for doing what he did it in a very unethical manner. Alright? So the bird egg falling into the feces, cat feces, not playing with cat feces, very important deal right there. But just remember that cysts in food are the #1 cause. And everything else in the story just falls into place. You have your Beethoven, you have the intracranial calcification cat, you have your hydrocephalus cat with the seizures, right? You have your sulfa eggs, and you have your CD4 count, IgG. Everything else is there. Torches infection, obviously, because it can cause congenital toxo, and that's really it. Nothing too ridiculous. Nothing too ridiculous. All right. Now, Naegleria fowleri is crazy. So this image is going to be called Niagara Falls, and that's because that'll help you remember Naegleria fowleri. So this causes rapidly fatal meningoencephalitis. Now remember, the #1 cause of encephalitis is usually sporadic encephalitis is usually the viral HSV1. But if it's not a viral thing, then you have to remember this amoeba, Naegleria fowleri. Its transmission is usually by swimming in warm, fresh water. So think of the Nalgene bottle filled with fresh water containing Naegleria. Now, if you've never seen the Nalgene bottle, and I had never seen it either, so let me show you guys. This is what a Nalgene bottle is, this thing. See? It's just the company that makes a bottle like this. Alright, so the Nalgene bottle. But they use it for here in first aid itself to remind you of Naegleria fowleri. So fresh water, swimming in fresh water. So obviously everyone goes swimming in fresh water. Why not? And then if there is Naegleria fowleri in that fresh water, that's gonna suck, right? So amoebas in the CSF is what you're gonna find for diagnosis. So image C is showing you the amoeba in their CSF. Treatment, because it's so bad and so pretty much systemic in a way, because it just goes straight to the brain, you have to give amphotericin B. And amphotericin B has only been effective for a few survivors. Most people just die. So Naegleria fowleri just kills you. Right, that's it. There's really not much you can do. A few people that were able to reach amphotericin B in time will survive, but it's very unlikely that there's going to be amphotericin B just sitting around for these patients. Alright, because, like imagine going swimming and then all of a sudden you start feeling this rapid encephalitis. You're not going to have amphotericin B just there. So Naegleria fowleri, Naegleria Falls for Niagara Falls. Swimming in freshwater lakes is the key issue. The bacterial infection classically associated with swimming in freshwater is leptospirosis, and we saw leptospirosis with the Hawaiian guy, right? Annie Edson Taylor is the first person to go down Niagara Falls in a barrel. Some history right there, and that's her right here. She went straight down Niagara Falls in a barrel, and you can actually read more about that online. The barrel riders are in cribs to represent the crib reform plate, so they're in baby cribs, right? These don't look like real barrels, they're in baby cribs, the two white ones. So because it enters, the entry form it uses from the nose to enter the CNS and cause meningoencephalitis. So it just goes up the nose through your cribriform plate straight to the brain. Remember that mucor and rhizopus also enter through the cribriform plate, but they cause cavernous sinus thrombosis and facial pain. This patient will have nuchal rigidity and fever as well as an altered mental status almost within the first half an hour. Within the first few, like 15 to 20 minutes, they'll have their meningoencephalitis kicking in. The barrel rider with the neck brace and turban is for meningitis and encephalitis respectively. So this neck brace and the turban right here, this guy is just totally messed up, right? But he's going to survive. Why is he going to survive? Because he has the amphotericin B, right? So remember, amphotericin B was always amphibians. Amphotericin B. The guy on the right is dead because he smashed his head on a rock, and this is because the amoeba causes rapidly fatal death. Right, so this guy's already dead. There's no saving him. And you see he has that Nalgene bottle, the same bottle I just showed you guys. That's the Nalgene bottle right there. This is also associated with water sports. Hence the guy with the windsurfer, which is this guy right here. Right, freshwater sports. A spinal tap would show amoeba, hence the champagne with a syringe. Treat with amphotericin B, hence the amphotericin amphibians. Right, so her champagne is being opened with this syringe right here to show you a spinal tap that would reveal amoebas. And the amoeba also looks a lot more like the banana one too, so be very careful not to get confused about that. Right, so this amoeba in the CSF, this one was not in the CSF. This is what you'll find in the brain. This one you're finding in the CSF. Okay, so now the last one, image D. This is Trypanosoma brucei. Right, Trypanosoma brucei, or Trypanosoma anything really, causes African sleeping sickness. You know, enlarged lymph nodes, recurring fever because it has antigenic variation, somnolence, and coma. You have to remember the CC fly. Right, a lot of vectors get tested when it comes to these protozoa. The CC fly causes a painful bite and leads to Trypanosoma brucei African sleeping sickness infection. You will be able to find trypamastigotes in the blood smear, and that's what we're seeing here. Right, so we went from brain to CSF to blood smear. And you could tell this is a blood smear because there's a lot of red blood cells all over. Now, treatment for Trypanosoma brucei involves multiple medications. There's Suramin for the blood-borne disease, or Melarsoprol for the CNS penetration, which is why this patient would have somnolence and coma. And you need to treat it. This can't get better by itself. You have to treat it, otherwise it might get better and then it's going to get really bad again because of antigenic variation. They just keep changing their antigen, obviously due to mutations. Right? It's not checking correctly when it's replicating. So this is the image for Trypanosoma right here. Right? We have the sleeping sickness concept. So Trypanosoma brucei gambiens and rhodesians, right? Multiple names for this. Prince Bruce to the rescue. So you can remember brucei causing whatever issues is going to be right now. So Prince Bruce to the rescue. Transmitted by the CC fly. We have an ill princess in bed that has fallen asleep to remind you of sleeping sickness. The tea and teapot have a fly for CC fly, or TT fly if you have to. The vector found in western and southeastern Africa, depicted by the map with Gambia and Rhodesia, right? And Rhodesia is now known as Zimbabwe. Gambia and now Zimbabwe being mentioned into the map right here. Right? So those are the two endemic areas for the CC fly. The ruffles on her shoulder are for cervical and axillary lymphadenopathy. So you can see this, the ruffles. It's similar to the ruffles we saw in other pictures earlier. Diagnosis is from blood. Hence, she is bleeding, and the goat is to tell you that you will see trypamastigotes in the blood. Right? So it's almost like she commits suicide and then she's just dead. So she has a little bit of like bleeding from her finger right there and a little goat toy. The multicolored tints represent that its variable surface glycoproteins due to constant antigenic variation, hence the recurrent fevers. So everything's all so colorful, right? And the tints out there all look different. All the tints out here look very different. The parasites are motile with a single flagella, depicted by the single pink ribbon in her hair. And it's really hard to see it, but there's this one pink ribbon right there. Prince Bruce has a serum and soap, right? He's bringing a serum and soap, two different things to help her. Right, let me see. Though this is the soap right here hanging. Right, it's a soap bar, and then this bottle contains a serum. And these two things are going to save her. So what are they? The serum is for suramin, and the soap is melarsoprol. That's it. Right, which help peripheral blood and CNS infections respectively. Suramin for serum. Right, suramin for serum. Okay, suramin for serum, and then you have to remember melarsoprol, melanin for CNS, melarsoprol. And that's literally all there is to it. There's not much to know about this bug. Usually very straightforward questions and usually very straightforward answers as well, where you simply just pick either the medication or the vector. That's all they're really going to test you on this, for this bug. Okay, and the antigenic variation. These are antigenic variation, the CC fly, and then the treatment are the three top things they can test you on for Trypanosoma brucei, because they're pretty unique, they're pretty important, and there's really not much overlap. All right. Now the next few are the protozoa for hematologic infections. Right. So we have our big guy malaria, caused by all different kinds of Plasmodium, and they all cause different kinds of malaria. Right. Vivax ovale, falciparum, and malariae. And then you have Babesia. Right. We talked about Babesia a long time ago when we discussed Borrelia burgdorferi, because they both are carried by the same Ixodes tick. So if you have a patient with Borrelia burgdorferi induced Lyme disease, then you could also have Babesia in the same patient. So let's talk about Plasmodium first, right? Because malaria is extremely high yield. Now this is the real banana-shaped guy. But remember, up here when we saw the banana-shaped guy in this is in the CNS, right, for toxo. Malaria is also very much banana-shaped, but there's also different variations depending on where and when you got the blood smear. So let's take a look. And the image is going to be this one. So there's a lot happening in that picture. Before we get there, let's actually read what's up with the book itself. So malaria: fever, headache, anemia, and splenomegaly. So fever and fatigue, right? P. vivax and ovale, the two guys with the V in it, they cause a 48-hour cycle tertian fever on the first day and third day. Thus, fevers are actually 48 hours apart. Dormant form in liver, right, a hypnozoid. And that just works out because hypno for hypnosis, falling asleep, right? So the dormant form is called the hypnozoid, and you will find the dormant form in the liver. But Vivax and ovale cause 48-hour cycle fevers. So if fever happens, then you're okay. Then it happens again after 48 hours. P. falciparum is the worst. Falciparum is severe. It causes irregular fever patterns. Parasitized red blood cells occlude the capillaries in the brain. So you also get cerebral malaria, kidneys, and lungs. Right? Parasitized red blood cells. They're just going to start getting occlusions all over their body. And then depending on where the occlusion was, different symptoms will present. So very much like a stroke almost, if it's in the brain. The last one is P. malariae. This one causes quartan fevers, 72-hour cycle, right? So these cycles, I mean, that's all they really use to differentiate these guys. Other than that, Vivax, ovale, and malaria pretty much cause the same issue. Transmission is by the Anopheles mosquito, and you have to know that name, the Anopheles mosquito. Blood smear shows a trophozoite ring form within the red blood cell. So you can see this thing obviously looks like a ring within the red blood cell. Right, there's the top of the ring and then the whole ring itself. Within red blood cells, you see something called the schizont containing merozoites, red granules or Schaffner stippling, throughout red blood cell cytoplasm seen with P. vivax and ovale, which is image B right here. Right, so this actually looks like a granulocyte now, but it's a red blood cell. Right, so, and you'll know it's a red blood cell because it'll be the same size as all the other red blood cells in that smear, but it's going to have excessive stippling, right, the Schaffner stippling, and that's all just red granules throughout the red blood cell, only with Vivax and ovale. Treatment is pretty extensive too. There's different treatments. Chloroquine for the sensitive species, but not all species of Plasmodium are sensitive to chloroquine. If it's resistant, you use mefloquine or you use atovaquone and proguanil. If life-threatening, use IV quinidine or artesunate. Right? And if you're going to give quinidine or artesunate, you have to test for G6PD deficiency because these medications can spark G6PD deficiency-induced hemolytic anemia. For Vivax and ovale, add primaquine for the hypnozyte. Right? So you always need primaquine, pretty much. right? Anytime you have the hypnozoids, right, and obviously Vivax and Ovale are the only ones you really need to know the hypnozoid for, you give primaquine. Right? Vivax and Ovale are pretty intense because those are more commonly tested than the falciparum. Falciparum is pretty straightforward. It's just going to cause your severe irregular pattern fevers and a lot of really, really bad symptoms throughout the body. But it's not what's going to be tested much because it's pretty easy. I mean, if you get a patient with P. falciparum infection, don't choose to give them chloroquine. Don't choose to give them primaquine. Right? Just give them the more stronger medications, right? Give them the stronger medications, the more powerful medications, mefloquine, atovaquone, proguanil. That's it. If it's life-threatening though, if the falciparum has gotten really, really bad, then you pull out quinidine or artesunate, and these are great opportunities for the test to question you on G6PD deficiency, right? Because you cannot give these medications to patients with G6PD deficiency, or they're going to have symptoms of G6PD deficiency flare up. What is this? And this is actually, there's a bunch of questions in UWorld regarding chloroquine and primaquine. This is just one of them, so let's take a look at it. 34-year-old man comes to the emergency department due to recurrent fevers, chills, and excessive sweating. Symptoms began a few days ago and seem to occur every 48 hours. He recently returned from a trip to India. Temperature is 101.5. Physical exam is unrevealing. Lab studies are notable for anemia and thrombocytopenia. A blood smear with GM staining demonstrates red blood cell inclusions. He is prescribed chloroquine and primaquine. The addition of primaquine to the treatment regimen is most likely to have what effect? And we just mentioned it right here that the primaquine is there for the dormant hypnozoid, right? So by getting rid of the dormant hypnozoid, you prevent disease relapse. Right? The patient's symptoms, travel history, and tertian fever suggest malaria due to Plasmodium vivax or Ovale, which establish a latent hepatic infection in the form of hypnozoids, responsible for the relapses. Are you a first year student? I wish I started this as a first year student. Not started this, but I wish I had a resource like this when I was a first year student, because the earlier you start with all this stuff, the better. Like, you know, it's really, step one is very much time induced, right? So the more time you invest in like trying to memorize stuff, the more time you give, and long-term time, not like sitting 24 hours a day, but long-term time. For the more long-term time you invest into trying to go through first aid and looking at different diseases, looking at different pathophysiologies, the better. So if you are a first year student, then kudos to you for getting started at studying right now, because it's only going to make life that much easier. Alright, so let's take a look at this now. This right here is malariae, Plasmodium. There's a lot happening here. But as much as is happening here, this is one of those images that you're much better off actually seeing the video for, because when he starts from a blank canvas and then goes ahead and makes it, it's so much easier. At this point, it's just like, right now you're seeing a picture that has so many characters in it, it's really ridiculous. But I'm going to go through it anyway, just in case it helps. Either way, definitely worth watching the video for this. Alright, so Plasmodium, Malariae, Vivax, Ovale, and Falciparum, the queens and warlords of Plasmodium. One of the three major places you encounter Plasmodium is the African wilderness. Patients often have anemia and splenomegaly if they get malaria. For diagnosis, you do a blood smear with a GM stain to see parasites inside the red blood cell. There are 4 species, and they are represented by the different warlords searching for the blood gems. Alright, so you have your warlord 1, 2, 3, and this guy in the back. 4 different warlords searching for this blood gem over here. First, we have the guy in the middle, Malariae. He smells malodorous, which is this guy right here. This is Malariae. He smells malodorous, so you remember Mal. Hence malaria for the name. Fever occurs on day 1 and then reoccurs on day 4. Hence the 1st and 4th button on his tunic are red. Alright, so this is Malariae. He's smelly for Malariae, malodorous, and his 1st and 4th button are red for the quartan kind of fever you get. the black hypnotist represents Vivax and Ovale, and that's this guy right here. Hence the axe and oval shield, right? So he has this axe right here, and he has this oval shield, all holding both into the same hand. He's grabbing the axe, and the shield is kind of attached to his wrist. So that's Vivax and Ovale, and he's got this hypnotism tool to remind you that those two guys have hypnocytes, right? So we're gonna see that patients get a fever on day 1, and then reoccurs on day 3. So every third cycle of the swing is red, or tertian fever, right? This is swinging 1, 2, 3, and in the middle it's a black dot. So the first and third one. They produce dormant forms called hypnozoites and hepatocytes, hence the cowhide on the shield. Right? And this cowhide on his shield has a liver. So if that works for you, then that's perfect. When I first studied this, it did work for me. So we got down Vivax and Ovale, the big guy with the hypnozoites. We got down Malariae. Right, so 2 warlords are down. The third warlord is this guy right here. The next warlord, Falciparum, is wearing a false mask to the right. So false mask for Falciparum, or he's hiding his identity, right? So that's the false part. He is the worst and causes the most severe malaria, so that's why he's the scariest looking. Fever patterns here are irregular, like the bottom of his torn shirt. An occlusion of brain capillaries by parasitized RBC will cause neurological symptoms, hence the headpiece he has with the weird banana-shaped red stuff. RBC also occlude vessels to kidneys and lungs, depicted by his gold pieces. Right, so he has the gold pieces on his lungs and the gold pieces right here for the kidney area, everything being occluded. P. falciparum is banana-shaped and on red blood cell smears, hence the banana-typed headpiece. Right, so there's a bunch of banana-type stuff in his brain capillaries causing neurological symptoms. So pretty easy to grab that. So you got your 3 warlords for the 3 different major groups of Plasmodium. Now we're going to look at the queens, which are for treatment. The color queen and the colorful red outfit is for chloroquine, and that's this woman right here, the color queen. Chloroquine, which blocks Plasmodium heme polymerase. However, she's not helpful when she's hypnotized. So you get the primal queen and the tiger outfit, prima queen. Alright, it's going to take both of these guys to defeat this warlord because she cannot handle the hypnozoites, right? That's why you always add prima queen. So we got our color queen and our primal queen. So chloroquine and prima queen works perfectly, right? Check for G6PD deficiency with prima queen because you can cause hemolytic anemia. Chloroquine sensitive species are rare due to anti-malarial resistance. So the only chloroquine sensitive areas are the Caribbean and some places in the Middle East. Hence, it's better to rely on mefloquine, represented by my fly queen, with all her feathers in her royal palanquin. Also, mefloquine is a great prophylactic medication for people traveling to chloroquine-resistant areas like Africa or India. So that's her right there. That's the my fly queen. Wait, is it her with all her feathers and her royal palanquin? No, that's her right here. Right, she's super fly, being that when you're really fly, it basically is a way to say that you're really impressive or you're really cool or something. So she's the mefloquine, and she has a bunch of baggage. I was going to say luggage and baggage at the same time. She has a bunch of baggage, right, because she's traveling. So that's what kind of just works out. Palanquins represent medications that are extra good. She also has an iguana as a gift to represent... Where's the iguana? Wait, did I skip? Oh, I did. Hold on, wait. My fly queen. Okay, also, mefloquine is great for people who are traveling. So the backpack's on her palanquin up there. Okay. Note also the Atova vampire from the babesiosis video. That's her right here. We haven't done babesiosis yet. That's next. But this same vampire is here too. And why is she here? Because atovaquone is also inside a palanquin. Atovaquone is another medication you could use for malaria as well. Palanquins represent medications that are extra good. She also has an iguana as a gift. Right? And that's the green iguana on her lap right there to represent proguanil. Right, so 1 palanquin, 2, and 3 different palanquin medications that are really, really good. We have our mefloquine from My Fly Queen, the Atova Queen from Babesiosis. We're going to see her soon. And then this last one back here, for P. falciparum treatment, we use artemisins, depicted by the artist in yellow. Artemisins? Was it artemisins? What is it called? Let me see. Artesunate. I don't know why I wrote what I wrote here. It's called artesunate. Oh, it is artisanate. What was I reading? Alright, so, artisanate right here. Okay. So for P. falciparum treatment, we use artisanate depicted by the artist in yellow. Some of those infections can be fixed with Atova or proguanil infection treatment also. Not infection. So he is painting her, right? So what he's really doing, and you can't see it anymore because he drew over this, is he's sitting there painting the Atova queen, right? So you could use both artisanate or Atova queen for P. falciparum. He's holding a sickle because sickle cell disease is also protective against P. falciparum malaria. And we've learned about sickle cell being a protective mechanism for patients who can get malaria. IV artisanate is for severe malaria infections, and that is represented in the far right as a painter. This guy right here, another artist. IV quinidine is the dining queen in her palanquin on the far right. This medication is known for synchronism and tinnitus. Quinidine, remember quinidine was one of the medications in cardiovascular? That's the same quinidine we're using over here now. Both drugs must be delivered IV for severe malaria, hence the IV. Right, so she has a bunch of IV around her palanquins. Right, quinidine is a medication that we discuss under cardiovascular pharmacology, and it just so happens it's a medication you can use for P. falciparum as well. And if you didn't remember that, then you should have, but now you definitely will, for sure. You're not going to forget that anymore. Last thing here, the life cycle. So the life cycle of malaria is depicted by the cow, which is right here. It is transmitted by the Anopheles mosquito, which carries sporozoites in saliva. The sporozoites are represented by the red mushrooms under him, right here. Once the hepatocytes rupture, they release... Sporozoites travel to the liver and mature to trophozoites. Right, so these guys are going to go in the liver, they're going to get mature. And then they become schizones. And once the hepatocytes rupture, they release merozoites that go in infect red blood cells. So it's a merozoid that's going to infect the red blood cell. But you can find schizones in the hepatocytes. Very important little dump cycle that you definitely need to know because you can get tested on it or it can be described in a question stem. This is all depicted by the spots on the cow, and that's kind of what's happening. It's just moving around and it's going to infect this red blood cell. The far right mark on the cow is the ring form of the immature schizone shape in it. Merozoites can also form gametocytes in red blood cell, hence the gender signs. When the mosquito bites an infected patient, it takes up red blood cells with gametocytes, then infects others. And so that's generally how everyone ends up getting malaria if one person around them has malaria. Now this image here is for Babesia. Right? So we have our Robin Hood from your Borrelia burgdorferi, right? So this is Robin of burgdorferi, or Robin of Borrelia. So let's look at babesiosis. Babesia also has a ring thing, just like we have up here, right? But the more important one is number 2, the Maltese cross, which you won't see anywhere else. That's strictly Babesia. Babesiosis is fever and hemolytic anemia, predominantly in northeastern United States, right? So this time you don't have to go to Africa or India for that to happen. It's just happening in the northeastern United States, very similar to the same place where you're having Lyme disease from. If you have asplenia, right, so sickle cell patients, they have increased risk for severe disease, right, so severe disease in asplenic patients. Ixodes ticks, same as Borrelia burgdorferi of Lyme disease, may often co-infect humans, so you get both diseases at the same time. Treatment is with atovaquone and azithromycin. Right, so we're going to see our atovaquone, so the Atova queen, which was mentioned, atovaquone or proguanil, for your chloroquine-resistant plasmodiums, right? So there's your Atova queen right there. Let's take a look at what's happening here. Babesia, the vampire babes. About 25% infections are subclinical, but some infections can cause malaria-like symptoms and death. The vampire babes remind us that babesiosis causes blood-related symptoms like hemolytic anemia, hemoglobinuria, and resulting jaundice. Babesia is carried by the Ixodes tick and is spread by its saliva. The longer the tick is attached, the higher the transmission. The Ixodes deer tick also carries Borrelia burgdorferi, so Lyme disease co-infection is common. Approximately 25% of people in Rhode Island are seropositive for Babesia. Rhode Island is very close to New York. The shields with ticks and deer antlers are to depict the Ixodes deer tick vector. Right, so you see the shields in the back with the deer antlers. The blood-stained windows on the left are for hemolytic anemia. Right, these are all red, but they're all kind of lysed. They're all broken. So hemolytic anemia. The yellow vampire on the far left represents jaundice. This one right here. The irregular jagged pattern. Oh, sorry. Wait. The vampire babes caught Robin of Ixodes, who is sweating feverishly due to full-fledged babesiosis. So that's him right here. He's all caught and hung. The irregular jagged pattern his shirt is torn in reminds us of the irregularly cycling fevers. The leader of the vampire babes is holding a sickle to represent the higher risk in sickle cell disease patients. And that's her right there. Asplenic patients will be symptomatic and have more severe disease. The hole in Robin's shirt is like a spleen to represent asplenia, which is this one right here. Diagnosis is with a blood smear, hence the thick red carpet. The Maltese cross, which is right here on the floor. Right, so you have your red carpet with the Maltese cross. The Maltese cross represents the appearance of an infected red blood cell. It's formed by the tetrad of trophozoites and helps differentiate from malaria. It's also acting like a compass and pointing northeast. Right, so you have your northeast pointing right here for telling you where you find Borrelia and Babesia. The queen's name is Queen Atova, hence the treatment is atovaquone. The crows are for the macrolide, azithromycin. So there's just crows. Where are the crows at in this picture? Oh, okay, they're just sitting on her shoulder. I see. It's kind of masked up by the purple. It kind of looked like it was part of her shoulder now. But yeah, there's crows on her shoulder. They should have put the crows somewhere else so it doesn't kind of blend into the color. But generally speaking, Babesia is really easy to remember because if you get a patient with Lyme disease and then they have hemolytic anemia and they are asplenic, you really want to consider they probably have babesiosis as well, and you have to give them atovaquone and azithromycin, as well as whatever you're going to need to treat the Lyme disease, depending on what stage the Lyme disease has gotten to, right? Doxycycline or something. So all the medications can be tested. That's your microbiology pharmacology mixture that can occur. So that wraps up your hematologic infections, right? So really not that bad so far at all. Protozoa for the GI infections, protozoa for the CNS infections, and then you have your protozoa for hematologic infections. Only two of them really. Right? In the next page, they start going into protozoa for other unrelated things, right? And one of the bigger guys here, you have your Trichomonas vaginitis from Trichomonas vaginalis. You have to know all the different guys that cause different forms of vaginosis or vaginitis, so very important to remember their major differences. So far, we've covered Gardnerella vaginalis. We covered Gardnerella. We understood that the price was 4.5 and above in that picture. There were clue cells. There was KOH staining. It was not really 1 gram, so it could be gram positive or gram negative. And metronidazole was the treatment there. So that was one we've already covered. Then we're going to be looking at all of this in the next video, where I'll continue from protozoa others and keep going until the end, because that's pretty much the end of it. Yeah. All right. So that's it for that. We got a third-year student. Are sickle cell patients only resistant to P. falciparum? Oh, is it just falciparum or Vivax and Ovale and the others as well? Yes, they're only really resistant to falciparum because falciparum is the only one that causes infection by actually parasitizing red blood cells, right? But if you're a sickled red blood cell, the parasite can't get in there. That's the main concept there, right? One of the major reasons P. falciparum is so problematic is because it gets into red blood cells, and then you have all these red blood cells that are now going to have a really, really bulky shape, and then they get stuck everywhere. Right, so you occlude capillaries in the brain, kidneys, and lungs. But if you have sickle cell, now your red blood cells have a very weird shape, and this banana-shaped P. falciparum can no longer enter the red blood cell, so you don't have falciparum invasion in those red blood cells, and they won't get stuck everywhere. So that's why, yes, the patients who have sickle cell, they're going to be resistant mostly just to falciparum. They could have some resistance to Vivax and Ovale as well as malaria too, but not really, because these guys, the other ones, Vivax, Ovale, and malaria, generally speaking, they only cause fever. Not so much of the other stuff. They cause a lot of fever. There will be a little bit of anemia and splenomegaly, but not so much necessarily. But falciparum causes many other issues because of the occlusion of blood vessels everywhere. So like having a stroke and stuff. They all have that. They're all able to have that. The blood smear is going to have a trophozoid ring formed within the red blood cell, and schizons containing merozoites, and merozoites are the thing that actually invade red blood cells later on, right? But these two things, images A and B, are found in all of them. They all have the ring as well as the stippling, the Schaffner stippling, but the only major other thing is that falciparum uniquely looks like a banana and is able to invade red blood cells, make the red blood cell really, really big and bulky, and then that red blood cell gets stuck everywhere in capillaries. And then depending on what capillary, you can have different symptoms, and the patient's going to be really, really bad, right? If it's stuck in capillaries in the brain, that's going to present like a stroke. If it's stuck in capillaries in the kidney, you're going to have nephritis right there. And then if it's stuck in capillaries in the lungs, that can actually present with a lot of symptoms very similar to pneumonia. So that's the most severe form of malaria that you're going to see. And thankfully, people who, thankfully, patients who have sickle cell, there's at least one good thing they gain from having sickle cell, which is resistance to malaria. All right, but not all forms, mostly just P. falciparum. All right, so thanks a lot for joining today, guys. I'm going to stop here for now, and then in the next video, I'll finish up all the protozoa.